Hello, everybody. Welcome back to Practolytics. Thank you so much for joining in the part 2 video of the routine food care service series that we are doing. And in the last video, we have learned basics, the CPT guidelines, and a very quick walkthrough of the Q modifiers. Right? And in this video, we will see what are Q modifiers, how to apply these modifiers based upon the patient's conditions, and much more. So, with no further delay, I will just start the video. And now, let's see what's a class A finding is and what are all the conditions that fall under this category. If the patient is having non-traumatic amputation of the foot or integral skeleton portion thereafter, it has to be categorized as a class A finding. Similarly, absent posterior tibial pulse, advanced tropic changes such as hair growth, decrease or absence, or any nail changes. It could be thickening or it could be pigmentary changes, discolorations, change in the texture of the skin. If the skin is becoming thin, shiny, or any skin color changes like redness, robber, all these three are required. And absent dorsalis pedis pulse. These should be categorized into class B findings. Similarly, if the patient is having claudication, temperature changes, likewise cold feet, edema, paresthesiasis, abnormal spontaneous sensations in the feet, and burning sensation, all these conditions will be categorized into class C findings. Okay. Now you know what a class A finding is, class B finding is, and class C findings are. Now let's see how to apply this. If you identify one class A finding in the patient, then please make sure that you are adding a Q7 modifier on your claim form. Similarly, if you identify two class B findings, append a modifier Q8. Likewise, one class B and two class C findings will lead to a modifier Q9. This will make sure that you are getting appropriately paid for the routine food care services that you render for your patient. Moving on to the documentation requirements that are essential for the routine food care services. All the indications must be clearly documented in the patient's medical record and make it available to both Part A and Part B MACs upon their respective request. Documentation supporting medical necessity, such as physical or clinical findings consistent with the diagnosis and indicative of severe peripheral involvement, must be maintained in the patient's medical record for sure. Physical findings and services must be precise and specific. If you want me to give an example, that would be left great toe or right foot, fourth digit, fifth digit. It has to be very, very precise when it comes to the documentation. Similarly, documentation of any coexisting systemic illness should be maintained. There must be adequate medical documentation to demonstrate the need for routine food care services as outlined in this LCD. There must be adequate medical documentation to demonstrate the need for routine food care services as outlined in your respective state local coverage determination. The documentation may be office records, physician notes, or diagnosis characterizing the patient's specific physical status as being of severity to meet the criteria for exceptions to the Medicare routine food care exclusions. For each service encounter for debridement of the mycotic nails, the medical record should contain a description of each debribed nail that reflects clinical descriptors consistent with the mycotic nails. If appropriate, the clinical descriptor may encompass multiple nails with the same findings. Example, the nail for toes 1, 3, 5 are yellow, brittle, shiny, thickened, etc. Moving on. Please do remember, when the documentation does not meet the criteria for the service rendered or the documentation does not establish the medical necessity for the service, Such services will be denied as not reasonable and medically not necessary. I hope this video helped you in understanding the coverage determination concepts and the important concepts like how to apply the Q modifiers on your claim form to make sure that you're getting paid appropriately and as required. We will be back soon with another video which will help you understanding the utilization guidelines and the coverage indications for these routine food care services. So please stay tuned to us, and if you have any questions in the meanwhile, please do not hesitate to contact us. Thank you so much for your time.